There's a lot going on this time of year at the Idaho State House. Committee meetings, bill proposals, and key debates that could shape Idaho's future. I'm James Dawson, state government reporter for Boise State Public Radio, and I spend my days from January to April sorting through the action at the legislature so you don't have to. Sign up for my weekly newsletter, Legislative Roundup, and you'll get each week's biggest news and developments from the session delivered straight to your inbox every Monday morning. Sign up for Legislative Roundup at our website, boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. This is Idaho Matters. A measles outbreak in Texas has health officials concerned about the spread of the disease to other parts of the country. Last Tuesday, there were 24 confirmed cases of measles in a small West Texas county. By Friday, it had doubled to 48 cases. And as of this morning, health officials are reporting 58 cases, with 13 people needing to be hospitalized, all of them school-aged children. Health officials say all the cases are unvaccinated individuals or individuals whose vaccination status is unknown. So, what does this mean for folks here in Idaho? Dr. David Pate, former CEO of St. Luke's Health System and the co-author of the book Preparing for the Next Global Outbreak, is joining us now to talk more. Hi, Dr. Pate.
Hi, Gemma.
And folks, remember, if you have a public health question, send us an email, idahomatters@boisestate.edu. So, Dr. Pate, let's start today by talking about this measles outbreak because there are concerns that this is going to spread even farther. So, what do we know right now?
Well, so far, what we know is that this is the largest outbreak of measles in the state of Texas in roughly 30 years.
They're also seeing outbreaks now in New Mexico. And this is in a county that's bordering the county in Texas where these outbreaks have happened. But with that said, what should folks here be concerned about? Because this Texas health officials say this is probably going to continue to spread because it's such a large outbreak. In fact, in the county where this outbreak started, they're doing free vaccination clinics of the MMR vaccine, urging people now to get vaccinated.
This has already still been increasing even over the weekend. And so the key thing is you might want to check with the daycare to ensure that children are vaccinated there to determine the risk, because we're going to see more and more of this with time. The big thing for those who do get measles is we have to remember that measles in a large percentage of those children will wipe out the immunity they have acquired from other infections and vaccinations for a period of up to several years. And so you need to be careful even once your child is recovered from the measles.
And Dr. Pate, can we talk about, as you said, the severity of measles? Because we know that the MMR vaccine is safe, it's effective, 97% effective in people not getting measles, even if they've been exposed to measles. With that said, according to health officials in Texas, the Texas Department of State Health Services, they said the majority of these cases are in children ages 5 to 17. And as I mentioned, 13 people have been hospitalized so far. This is in particularly dangerous to children 0 to 5, in particular babies, because they can't be fully vaccinated. But also this can impact people with compromised immune systems, like pregnant women.
Absolutely. So, measles is one of the most contagious viral diseases that is known. And the problem is it can cause serious outcomes. We've had outbreaks in New Mexico, Georgia, New York, Rhode Island, Alaska, and 43% of those cases ended up hospitalized. And children, one of the most common deaths from measles is pneumonia, but they can get lots of other things, and including some very severe brain complications. And all of this is for naught, because, as you said, we have a very safe and a very highly effective vaccine. This is extremely effective, extremely safe. This point in 2025, we are rejecting science that we have known for many decades.
And a big thank you to Dr. David Pate, former CEO of St. Luke's Health System, as well as the co-author of the book, Preparing for the Next Global Outbreak. I'm Gemma Gaudette, and this is Idaho Matters.
We're more than just podcasts and a radio station at Boise State Public Radio. We're a trusted resource and a lifeline for communities across Idaho. It's up to all of us to safeguard public media's future. You can learn more at protectmypublicmedia.org. Together, we can ensure that Boise State Public Radio remains a trusted resource for you and your neighbors for generations to come.